On this episode of Paramedics,
What's happening?
can Cam's detective skills crack a critical case?
A million things are rolling through your mind. There's just something not right about him.
Why can't you talk to me? Can you swallow? Kapil.
Let's get your legs up.
A bizarre case completely baffles Risky and Nicola.
Holy guacamole, that was a weird job, wasn't it? What a doozy. Oh my God.
And an out-of-control heart rate puts a mum of 5 into the danger zone.
Keep going, keep holding. One more.
Emergency services, tell me exactly what has happened.
My son not breathing. Please hurry.
At Melbourne's Emergency Communication Centre, a terrified mother is on the line.
I'm organising help for you now, so stay on the line. I'll tell you exactly what to do next.
The woman thinks her 24-year-old son has gone into cardiac arrest.
Ambulance, please, ambulance.
Listen carefully. Lay him flat on his back on the ground and remove any pillows.
No English.
Single responder Cam is only minutes away.
From the limited information that we have that the patient's not breathing at all, it does say that there's going to be an English barrier there, so whoever's made the call, perhaps they're unable to decipher exactly what they're saying, but we're suspecting a cardiac arrest in a young person.
Outside of hospitals, only 1 person in 10 survives a cardiac arrest.
It's the worst of the worst. Sometimes people grieve, they're screaming, sometimes people threaten you.
Ambulance.
Everybody reacts very differently.
G'day, mate. How are you?
Cam enters to find a house full of people.
G'day.
I'm directed into a room, and if that's the patient, he's standing up. And I thought, well, he's obviously not in cardiac arrest.
If he's conscious and breathing, that's okay. My name's Cam. Pop him back on the bed for me if you can. He's conscious breathing, not an arrest, okay? Downgrade EMR, please.
While Cam is ruling out a cardiac arrest, the young man is still in extreme danger.
Okay, let me in. Hey, do you have any pain?
A million things are rolling through your mind. What could this be? He looks unwell, but there's just something not right about him.
What's his name? Kappentori. Open your eyes. What's happening?
Which one's Fitzroy Street?
In the city centre, Nicola and Risky are wolfing down dinner before they get another call out.
On the job, we never know when we're going to get a meal break, so definitely snacks are essential. I get hangry anyway if I haven't eaten, but being pregnant, like, my hangriness just is next level.
139, are you on the channel?
139, we got details, thanks.
But their food will have to wait. They've been called to a young woman who's been found wandering the streets in a bad way.
Her patient has had an allergic reaction in an unconscious state.
We're going code 1, lights and sirens to this patient, because if it's an anaphylactic reaction, we need to get there as soon as possible because the patient could deteriorate really quickly. So it's this where the lights are?
Yeah.
Anaphylaxis can quickly cause airways to swell up, close over, and stop the patient breathing. Fortunately, Risky and Nicola are only seconds away.
I'll see you 139, we're getting waved down here, so we'll jump out. Doesn't look very good, whatever it is.
Doesn't look very good, does she?
No. Does anyone know her?
No, I just found her.
No. Hello. When we pull up, I see this lady hunched over, her mouth open, and just lots of drool coming out of her mouth. This is pretty unusual. There's so much saliva. I've never seen anything like this before.
Emergency services, tell me exactly what happened. My brother's been calling me saying that my sister, who has SVT, a heart condition, her heart rate has been about 145 for the past 3 hours.
The worried family of a 39-year-old mother of 5 is asking for immediate assistance. Mobile intensive care paramedic Glenys is on her way.
This traffic is horrendous. Wait there, little car. There you go.
The patient has SVT, a condition that causes a dangerously fast heart rate. She's newly diagnosed, but has already had numerous bad experiences.
She is a bit resistant to having ambulance calls. She's like that. She's quite fearful of hospitals. She's been there a few times the past year, and she was arguing with me saying she's going to leave if we do call.
Another crew has also been sent to the woman, but Glenys is bringing the treatment, a drug called adenosine.
It's a fantastic drug. It'll revert the rhythm, it'll get them back to normal, but for a brief period of time it stops the heart and it makes them feel absolutely terrible.
Knock, knock. Hello. Hi, how are you? Good. Better than someone else here. Hi. Your name is?
This is Joanne.
Joanne, I'm Glenys.
Joanne's brother Max has been trying to talk her into calling paramedics for several hours.
Well, I try to wait and see if it goes away. It's not going away.
This is the 4th time this year she's had it. She's not medicated. She's due to see a cardiologist. She has had adenosine in the past, and I'm assuming that's why she was reluctant to call us today. What did you give the tightness out of 10?
Maybe a 6 or 7.
So it's pretty uncomfortable then. Yeah.
The longer Joanne's SVT is left untreated, the more damage she could be doing to her heart.
The average heart rate is 70 beats per minute. Joanne's today is 170 beats per minute, and that is really fast. If left untreated, she could lose consciousness.
Just really hot now, sweating.
Yeah. Cup and Torty. What's happening? What's happening?
Intensive care specialist Cam is desperately trying to get a response from his patient. 24-year-old Capentori is struggling to breathe and looks critically ill.
Tell me a little bit about him.
Very quickly, I get the picture that there's going to be a little bit of a language barrier, but you need to gather as much information as you can before you make a rush decision.
What's this injections from?
Last 4 days in hospital discharge.
What for? Just see if you can get a history for me. Hey, do you have any pain?
Yeah.
So I get the whole team working for me. I get Sam doing further assessment, and there's another ambulance crew on scene. Then I ask them to investigate his past medical history.
Yeah.
Significant cardiac history. Yeah. More, okay?
Okay. Sats are really low. Can you pop a non-rebreather straight on the other side for me, please? Yeah.
His heart is on his right side.
Okay, so.
So most people are born with their heart on the left side of the chest, and he was born with his on the right side. As I'm gathering information and think, what medications is this guy on, I notice that his breathing is very slow.
What do they call him?
Kapil.
Kapil! What's happening?
At last, Kapil manages to get out a few words.
Oh, fine. You're fine? He's telling me he's all right.
So no chest infection in hospital, discharged on Tuesday.
When was that, Tuesday?
Yeah, just recently. And then there's been a bit of a party here today.
Okay. Do we know what he's drunk? Beer, spirits, wine?
Once I ascertained that he might have had a little bit of alcohol, compounded with the fact that he's recently been at hospital for a very nasty chest infection, and I start investigating the medication a little bit further.
Mixing alcohol with prescription drugs can be fatal. Cam urgently needs to work out exactly what Kapil has had to drink.
Kapil, why can't you talk to me? Can you swallow?
Hello. Let's get this off.
In Melbourne's city centre, a bemused Nicola is trying to help a woman who's spitting up huge amounts of saliva.
Just, okay, walk to the car. We'll work out what's going on.
It could be an allergic reaction, but it's a very strange case.
Up here.
What we're faced with here is blowing my mind. I've never seen anything like it. This could be a reaction to a medication, but it's just all a bit weird. It's just not making sense at the moment.
Sit on the bed here. Maybe they've given her Maxilin or something.
Extrapyramidal reaction.
So you've come from the hospital, and what happened there? For this? Did they give you medicine? Come from St. Vincent's? Yep.
The woman has already been at hospital today, but can't explain why.
Is it sore? What's your name? Ruka. Ruka.
Ruka's symptoms are becoming more unusual by the minute.
She's got this locked jaw, her tongue is in a weird position, she's drooling everywhere. Do you have pain? Although her symptoms are really bizarre, it doesn't mean she's not having a serious allergic reaction. So we need to assess her and get her to hospital ASAP because this could still be life-threatening.
Anyway,
Oh my God,
we'll go the big
I
one.
can't do this.
Yes, you can.
Needlephobe Joanne is already tensing up as Micah Paramedic Glennis sets up her IV line.
Oh my God! All right, nice and still. All done.
Well done.
The mum of five's heart is racing out of control and needs to be urgently restored to its normal rhythm. The treatment is a wonder drug called adenosine, which is very effective but has terrifying side effects. Joanne is dreading it.
Adenosine stops the heart. Joanne knows what this feeling's like. So before we use adenosine, we're going to try a technique called the abdominal Valsalva manoeuvre.
Have you done this trick before?
Not in a syringe. I've been trying to find other things.
All right.
Oh, sorry, I'll get out of the way.
We asked Joanne to breathe down on a syringe for about 10 to 15 seconds, and hopefully this will get her heart back into a normal rhythm. Now, I want you to push that plunger all the way to the 10.
I never can.
Blowing on a syringe puts pressure on the lungs and can trick the brain into slowing the heart. It's Joanne's one hope of avoiding adenosine.
Ready, set, go.
But will it work?
1, 2, 3, keep going. 4, don't stop. 5, 6, keep going, keep holding, keep pushing, keep pushing, keep pushing, keep pushing. One more, one more, one more. Good girl. Relax.
Let's get your legs up, Ruka.
Back in the city centre, Ruka's bizarre locked jaw has Risky and Nicola scratching their heads.
Did you just leave hospital now? And this just happened all of a sudden? Yeah, okay. Obviously hard for you to talk to us, so it's hard for us to know what's going on.
A large part of our job is problem solving, but in this case, it's quite difficult to assess. I've never seen anything like this in 10 years, let alone this much saliva ever.
As paramedics, we get exposed to all kinds of bodily fluids. And for me, drool and saliva is the one that I can't handle the most. You gonna vomit? Or you just need to spit? There you go. Saliva and phlegm makes me gag. So I'm spending this job trying not to vomit. Hard to swallow?
So the thing with Nicola is she's so professional and she's so good at her job that you don't know if things are affecting her or not. I'm looking in the rear vision mirror and something's not quite right. Something's really getting to her at the moment.
With Ruka still struggling to communicate, Nicola remains mystified about her condition, but she's very happy they've made it to the hospital.
See if you can spit that out. That's it. Good job. Now that I've spent a little bit of time with Ruka, I no longer think this is an allergic reaction, and it's now up to the doctors to work out exactly what it is that's going on. Holy guacamole, that was a weird job, wasn't it? What a doozy. How bizarre.
Oh, wowee.
I don't know how she would produce that much saliva. I can handle vomit, I can handle poo, can't handle stringy saliva.
After 8 years of knowing you, I didn't know that that was your kryptonite.
Oh, yeah. It's definitely my kryptonite.
There's been a bit of a party here today.
It's okay.
In the southeastern suburbs, Cam is now worried Kapil has been mixing alcohol with prescription drugs.
Do we know what he's drunk? Beer, spirits, wine?
What has he been drinking?
Nothing. No.
There's been a party at the house that day, but the family's adamant Kapil has not been drinking.
What age was his heart diagnosed?
1.5, 1 year,
Yep.
1 month.
Yep.
Surgery.
And he was born with the heart on the wrong side?
Yeah. No.
Why is he on warfarin and Clexane?
This thick, no blood.
No.
Blood, no thick.
His blood's, okay. Try the O2 on that side, can you? He's had a stroke, has he?
Yeah.
Does his finger not straighten?
So the more I look at Kapil, the more I think he's got an extensive medical history. With his heart, I can see that his hand looks a little bit crippled and he's taking an injection to thin his blood.
Hey, does he take any regular pain medicines, please? You do? Have you had a lot of pain medicines today? Hey? Do you reckon you've had too many? He looks as though he's affected by maybe medicines at the moment, perhaps, because his blood pressure's good, his heart rate's good, but he said he does take medicines for pain. Does he ever take too much?
Yeah,
Okay.
too much.
Yeah.
His brother is saying a few days ago he took too many endo. And now he's going, well, I reckon he's been doing that a bit.
This one too much.
And on top
Diet.
of that, his sleeping tablets on top of the endo.
Yeah.
So, mate, we think you might have had a little bit too much of your pain medication. Do you think that's what's happened? Yeah. So what we're going to do, we're not going to completely stop the pain medication. We're just going to give you a little drug called naloxone, just to slow it down a little bit, okay? So it's not affecting you so much. It won't hurt, okay? We'll make sure you still got plenty of pain relief.
Kapil needs to take opioids to cope with the pain caused by his heart condition. But if he's taken too many today, it could be deadly.
Okay, I'm going to help you swing your legs off the bed, okay? Sit yourself up, bud.
Lots of blankets on you.
He needs to be careful with those kinds of medications, especially when he's unwell. Like, they are very strong and can be very dangerous.
Yeah, I know.
You lightheaded? She's speechless.
Intensive care paramedic Glennis is desperately working to slow down 39-year-old Joanne's dangerously racing heart. If paramedics can't get it back to a normal rhythm, this mum of 5 could suffer permanent damage. They're now trying a natural breathing technique.
Congratulations, it did nothing.
It hasn't worked. Joanne will now have to endure the drug adenosine and all of its drastic side effects.
Are you anxious before we've even given you the thing?
Yeah.
Oh, darling, you know what's going on, don't you? Adenosine stops the heart for a few seconds. In that time, there's this overwhelming feeling of impending doom, and for some people, it feels like they're going to die.
Uncle Max.
Yeah?
Come here, please.
Max, come around and hold her hand.
Joanne is asking for her brother Max's support.
You ready?
No.
As she steels herself for the horrifying experience of having her heart stopped dead in its tracks.
Good girl. There you go. Good girl. Just about to hit her. She'll be feeling pretty crappy for about another 10 seconds. There she goes. Keep holding her hand. Good girl. How'd that feel that time? All right.
Now, your heart rate will go a bit quick for a while. It's in a normal rhythm. It's just going a bit quick until it catches up with itself. Okay?
You know, next time, call us earlier. All right. After Joanne's had adenosine, we've encouraged her that she does need to go to hospital. There's no guarantees that she won't go back into an SVT, and she probably needs to be observed for around 4 hours to make sure that doesn't happen.
Some little boy starting with L hasn't given Mum a kiss.
Levi.
Levi? Hi, darling.
A big one, a big kiss. I love you so much. I love you 3000.
I love you, Tracy.
See you, gorgeous.
With Joanne's 5 children being cared for by a neighbour, she's heading to hospital with her brother at her side. Doctors there will assess whether she'll need surgery to stop her SVT recurring.
Yeah, I know, mate. Trying to warm you up, Kapil. Trying to warm you up.
Also on the way to hospital is 24-year-old Kapil, who has accidentally taken an overdose of prescription drugs.
Hey, Kapil, you gave your mum a big scare, mate. You scared her, okay? She's right behind you now, okay? Hang on. Why does your what hurt? Your feet? Everything hurts. Maybe you've got an infection somewhere. I'll put this over your head. It helps with keeping the heat in, okay? So congenital cardiac disease, hypoplastic RL with single right ventricle, common AV valve, bilateral SVC, right side PDA, from right aortic arch, dextrocardia, recent tachyarrhythmias. When I eventually found all of his medical history, he's had so much intervention before. This guy's been through the ringer, he really has. Stroke in 2014 with left hemiparesis, mild restrictive lung disease, mild asthma. Oh my goodness, that's a very extensive.
Yeah.
How did you feel when you saw him tonight like this?
Everything blue
Yeah.
or no wake up?
No wake up, yeah. Yeah. And it scared you?
Yeah, how many scary?
Yeah. After all of the times that Mum's probably had Kapil in hospital for all of his medical conditions, and she still looks so distressed. So she must have been very frightened. Did it scare you tonight? Yeah, a little bit? Yeah, I know, mate.
Kapil will now be assessed to find out if the overdose has caused any permanent damage.
Hopefully Kapil learns from this and he's a little bit more careful with his medications in the future. I know, mate. I know.
It's a new day at the air ambulance base. The first case for flight paramedic Ray is a major car accident 50 kilometres northwest of Melbourne.
And did you receive all the details of the patient? One 7-year-old female, a 3-year-old female, a 35-year-old male, minor injuries.
2 cars have collided and there are 5 patients.
A 25-year-old female, head and neck injuries, and a 37-year-old female, heavily pregnant, trapped with bilateral leg and ankle fractures.
And Roger received. So just my planning, have we got 2 HEMS resources or 3 coming to this?
2 at this stage.
So these big accidents, everyone's involved. Fire department, police, multiple ambulance units, multiple helicopters. At worst comes to worst, we may very well call in another HEMS resource. 2 are coming to this job, we may need 3.
G'day Tiger, Ray here. Kid's relatively stable. I might leave that to you and I'll go to the pregnant patient. It's the other way around. Just might take that kid and run.
Yeah, it sounds like a plan. Cheers, Tiger.
Pregnant patients and children, always a challenge. And after having one, best part a year ago, kids emotionally will always tug on your heartstrings. But you throw the game face on, you do what you need to do.
HEMS 1's over here. Guys, Roger's coming back. Stand by caution, left or left. Roger's back along. Lanes are on, nose wheels on. Stable now. Stable. On the ground 3-0. Nice back, Ray.
Ray arrives to a disturbing crash site.
There's enormous potential for injury here. These cars are mangled, so the significance of the damage means probably the occupants are equally as damaged.
It's the start of a new shift for Amanda. With her longtime partner Taz on holidays, today she's working with Leonard. Right now, he's suffering from caffeine withdrawal.
I just need to, get a coffee and just relax. How important is coffee to my job? I would like to say it is critical. I honestly cannot start the morning without a good cup of coffee, and it needs to be the perfect temperature, otherwise my whole day is ruined.
I'd love a coffee. That would be amazing.
I just feel really frazzled at the moment.
Yeah.
But no luck for the coffee snob. A job's just come in, and it's a big one.
Okay, system 0524 is standing on.
C115.
It's a 73-year-old man with a suspected pulmonary embolism, also known as PE.
Huge clot in the lungs.
Not good.
Don't want that to move anymore.
It says massive PE.
Massive PE.
Massive.
That's not good.
Riding with Leonard and Amanda is an exchange paramedic from Vanuatu. Yvonne is about to witness a pressure, lights and sirens Code 1 job.
Diagnosis of presenting problem.
Diagnosis, she's a bit short of bed.
The radiologist who discovered the clot is still talking to emergency services.
He's not in distress, but he's got a massive pulmonary embolus,
Okay.
Medically, I'm surprised he's not more unwell.
Sissy on the left. So clots in the lungs are an incredibly dangerous medical event. You often get no symptoms leading up to it. Best case scenario, you'll get a little bit of shortness of breath, maybe a bit of chest pain. Worst case scenario, the first symptom will be death.
Surprisingly, 73-year-old Emery is standing outside the clinic waiting for them. For a man whose life is in immediate danger, he looks incredibly well.
Here to pick me up.
You up?
Yeah. I'm just going to organise to get my car picked up.
Oh, okay. All right, this is the patient.
You are a patient?
No, I'm the patient.
I've never seen any patient be as cool and calm as this guy. Given the diagnosis that he's got, I would have expected him to have been somewhat concerned.
Thank you very much for coming.
Simon the radiologist has now come out of the clinic.
I got a bit of a shock. He's got quite massive pulmonary embolus. He's got bilateral involving both main pulmonary arteries. He's also got a small saddle embolus, and he's got quite extensive above and below knee DVT from his groin to his ankle.
My only concern is if that clot goes on the trot and moves around a bit, we're in big trouble. Let's get you in the ambulance.
The news is not good, although Emery appears completely unaware of the danger.
A massive PE is essentially a huge clot that is sitting in the arteries of the lungs. It is a major, major problem because if that clot gets any bigger or dislodges, it can actually prevent blood from flowing back to the heart, which in that case will cause cardiac arrest.
We're going to come at you from all sides, Emery. All right.
Kids are gone 10, 15 minutes ago.
Kids are gone?
Yeah. Pregnant one's getting loaded.
Flight paramedic Ray has arrived at the confronting scene of a two-car head-on crash. Two children and their pregnant mum from the sedan are already on their way to hospital.
This one's currently more unwell.
Than the pregnant one?
The female passenger in the ute has only just been freed from the wreckage.
You can come roughly head first. We have to go side by side with that.
Del Castillo.
Hello, Anna Maria Del Castillo. My name's Ray. How are you feeling?
I feel very spaced, and I'm pretty sure that I've broken my collarbone and
Which side? Left side?
my left collarbone,
Yep.
my right pelvis,
Is hers?
probably my right foot.
Yep. So I continue to be amazed when I go to these car accidents. She's been spared just by the new design features of the vehicle. And while Anna's not walking away from this incident, she's alive and talking.
You guys have done such a great job.
You're
doing amazing.
An 88. I have to roll you. We'll be as gentle as we can,
I
okay?
can't really feel anything.
All right. Anna, you've had a lot of drugs to take that pain away. While Anna's in a happy place now, that doesn't mean she doesn't have potential to deteriorate, and it doesn't mean she doesn't have potential for more injuries. So while she's in this state, it's a good time to move her. Get her in the helicopter. We still really need to do a head-to-toe.
But suddenly, Anna's brave front crumbles as the reality of the accident sinks in.
There's Dane.
He's already gone to the hospital. He's okay.
If Dane's not with us, he's pretty good.
Ready? Anna and her boyfriend Dane were on their way to visit Anna's sister and her newborn baby.
It's all right, it's all noise. It's all noise.
It happened so fast. Traffic slowed down really quickly and I had nowhere else to go. I crossed over the other side and there was a car coming the other way. We had to head on.
Did you kiss into the tree? Is that your car?
That was, I think we hit the tree.
People came and helped us. All I was saying was make sure she's okay. I would definitely be lost without her.
You're okay.
Back in Melbourne's outer southeastern suburbs, Leonard and Amanda are assessing 73-year-old Emery following alarming scans at a radiology centre.
I'm just going to do some obs, blood pressure, look at your oxygen while you chat with me.
Blood pressure was done a couple of hours ago. It was 110/70.
Right, your oxygen levels are really good.
Although he appears perfectly well, Emery has a massive blood clot on his lungs. If it moves or gets bigger, he could end up in cardiac arrest.
How do you feel in terms of your shortness of breath? You seem puffy.
We don't have anything on board that can help Emery right now. We need to get this guy to hospital. He needs clot retrieval potentially, and he needs some clot-busting drugs. We don't carry any of those things.
Basically what's happening is, although you feel okay, things when you've got clots in your lungs, you can go from feeling okay to, well,
not so good,
very unwell in about a second. In Emery's case, I've told him the seriousness of the situation, but for some reason, he doesn't seem to be too fazed by it, and I think it's because he's symptom-free. He really is feeling normal.
If I wasn't here, I'd be on a bowling green.
Ah,
yeah.
on the bowling green, eh?
Emery is so relaxed, and that's a good thing because I don't want him to panic, I don't want his blood pressure to increase, and I don't want that clot to move one bit. Happy to head off.
Everything that happens is for the best.
That's a good way to look at things. On the way to hospital, Emery's chatting to me, but to be completely honest, I actually don't really know what he's saying because I've got my eye on that monitor. I've got my eye on his blood pressure, his oxygen levels. If he starts developing symptoms, he's in big trouble, really big trouble. I'm just going to do your blood pressure again, sorry. Just keep your arms straight. It just gave me a slightly lower reading than I would typically like.
A change in Emery's vital signs is a warning the clot could now be getting larger.
I noticed that Emery's blood pressure drops, and it's a significant drop, large enough to get me very worried. I need to be really careful. It could be the beginning of the end for Emery.
I'm going to do a little scan of your tummy. Some cold gel, a quick scan, then we're going to get up and out of here.
25-year-old Anna is about to be emergency airlifted to hospital after an horrific crash.
Am I bleeding?
Yes, possibly.
But flight paramedic Ray can't take off until he's certain she's stable enough to survive the flight.
In an accident like this, with the high forces involved, we generally see leg fractures. And you've always got to have a suspicion that there's potential spinal injury. You can get pelvic injuries and abdominal injuries. Okay, that looks pretty good.
I've broken my left collarbone.
Okay, you're holding that like that is the best thing you can do.
A gold collar and cuff.
Yeah, how you done first aid?
I'm an occupational therapist.
Well, there you go. So you're more than that. All right, so we can talk to you in normal language. Anna, being an occupational therapist, almost has no downsides. And that's a selfish thing from my point of view because it's easy to treat her. She'll tell me where the pain's coming from.
Anyone die?
No one's dead. You're the worst. You ready to go? I'm ready to go. But for Anna, she'll probably start fighting a mental battle, even between now and hospital, about I might have a fractured pelvis and I've probably got a broken leg or two. And she's basically going to know everything about the impact these injuries are going to have on her life. Hopefully not in the long term, but she's going to have to hang tough.
ETA there about 20 minutes.
It's all happening today, isn't it?
73-year-old Emery is on his way to hospital with a massive clot on his lungs. Leonard's just recorded a worrying drop in blood pressure.
My left leg in my calf, I feel as if I'm about to crack.
Yep.
If that means the clot is moving or getting bigger, Emery could end up in cardiac arrest.
You haven't been on any overseas flights or anything recently? None of that? Haven't had any recent surgeries to that leg? Okay. Well, looking at all your numbers, they're still all good. Yeah. So they paint somewhat of a picture. So I do another blood pressure reading, and thankfully, it's back to normal. But I'm not going to be relaxed until Emery gets to hospital, because they're the only people that's going to save him.
Despite needing urgent life-saving treatment by cardiac specialists, Emery remains unfazed about the danger he's in.
Who would have thought you've gone in for an ultrasound and then you get a CT?
I said to her as a joke, I said, well, does this show up that I'm pregnant?
The food baby, is it?
Emery had a very pleasant trip on the way to hospital. I'm glad he did, because Leonard and I were quietly pooing our pants.
Crazy. This is... Oh, I'm not going to get to walk in. Huh? No. As fit as a fiddle as you feel.
To do that. Very pleasant drive.
Most importantly, we got you here in one piece. So even when we hand Emery over to the hospital staff, our job might be done, but Emery's not out of danger yet. His body is riddled with clots. And until those clots get dissolved or removed, he could go into cardiac arrest at any given moment.
Can you scratch just above my lip? To the right. Just up, under my nose. Left. Thank you.
Flight paramedic Ray is on the way to a Melbourne trauma centre with 25-year-old Anna, the victim of a shocking car collision.
How are you doing? Is it sore? Here? Yeah. You'll find a bit of swelling coming out of there. I've given you some fentanyl.
The occupational therapist appears to have suffered serious fractures in both her feet.
In a high-speed accident, we've always got a fairly high suspicion that there's potential spinal injuries. So we take all those precautions, even if the patient's not complaining of any pain into their back or into their spine. You don't want to exacerbate that injury in any way. So the best thing we can do is just keep them nice and still and comfortable.
To minimise Anna's movements, Ray keeps topping up her pain relief. But that's causing some potentially dangerous side effects.
Anna, smell.
She's starting to get nauseous, which is not unusual.
Keep going. Are you guys sent back?
No. Might need you to do a circuit, Scotty. She's just having a spew.
Yeah, no worries, mate. We've got about 2 minutes to landing, mate. So
I'll give you
I'm happy to continue with the approach, and if we need to go around, then we can.
Yeah, so if Anna lies still on her back and can't literally spit all that vomit out and it goes into her lungs, complications of that is aspiration pneumonia. So we start getting a bit on edge because we really have to roll her. Our best option is to roll her towards us. That way we can keep an eye on her airway.
Okay.
It's not ideal, and you're probably going to torsion the spine a little bit, but whatever we do, whatever option we have here, when she gets sick, it's going to hurt.
You good, Anna? You okay?
Committed. Roger, committed.
With Anna's nausea under control, the team can finally land at the Alfred Hospital.
Anna, after that vomit, is life better or worse?
Bit better, but bit worse.
Bit worse?
Occupational therapists put people back together after something bad has happened to them.
Ray always makes me sick.
Now, she's going to have to apply that to herself. She's got enough injuries it's really going to either leave her bed-bound or wheelchair-bound for weeks and months.
I'm happy to roll.
Few little bumps, Anna.
She's going to need a lot of support, and the thing is, she knows all of this.
Everyone up on the stool and eat your fruit. Thank you.
It's now 12 weeks since Mum of 5 Joanne needed paramedics to fix her dangerously racing heart. Glennis used the drug adenosine to get the heart rate back to normal.
All right, my darling. You ready?
No.
But Joanne still had to go to hospital for further tests to find out if there was any lasting damage.
So that night, once I got to the hospital, I was there for about 4 hours, just waiting on my blood test results. Everything showed up normal, so now I just have to see a cardiologist and try to figure out as to why I'm getting these SVT episodes.
Now, let's all sing with Maverick. 1, 2, 3, go.
It's very frightening. I'm home on my own with the children, so like at any time it can just happen. I'm hoping that I can treat this SVT with medication and try to get back to somewhat of a normal lifestyle, considering that I'm frightened of, doctors and hospitals and so forth.
Open your eyes. What's happening?
After taking an accidental overdose, 24-year-old Kapil spent 2 days in intensive care.
Yeah, I know, mate. Trying to warm you up, Kapil.
He's now safely back home with his family and is taking more care with his prescription drugs.
Let's get your legs up and we'll just take you straight back to the hospital, okay?
As for Ruka, with her bizarre locked jaw and huge amounts of saliva, she was checked over in hospital and later released. But her strange symptoms remain a mystery.
That's it. Good job.
Occupational therapist Anna and her boyfriend Dane were lucky to survive a terrifying head-on collision.
Good, Anna?
But flight paramedic Ray feared Anna's severe injuries could stay with her for the rest of her life. Fortunately, the 25-year-old is looking at a complete recovery from several fractures in both her feet. No one is more relieved than the man who was driving at the time of the accident, her boyfriend, Dane.
I love her very much. So if I had lost her, I would have had to live with that for a long time.
Dane also broke an ankle and the couple face months of rehabilitation. But they're grateful they're alive and still have each other.
Accidents happen so fast and you never think it's going to happen to you. Life's precious and it can be taken away so quickly.
Here to pick me up.
You up?
Yeah.
Oh, okay. All right, this is the patient.
And it's now 3 months since Leonard and Amanda were called to help Emery after getting shocking news from his radiologist.
Let's get you in the ambulance.
The 73-year-old had a potentially deadly blood clot on his lungs, but was happily unaware of the danger he was in.
If I wasn't here, I'd be on a bowling green.
Ah, on the bowling green, eh?
Nice ball coming up.
Yeah, that's it.
Number one.
Well done.
I had no idea. I didn't realise until actually I got into the hospital just how serious it was. Yeah, lovely try, David. Good ball. I immediately received blood thinners. I felt like a pincushion for the next 5 days, and on the 6th day, I was told to go home.
You're looking good. How are you feeling?
I feel fine. I feel fine. Well, maybe it was a wake-up call. It certainly made me think a little bit more about life and how the road ahead is certainly shorter than the road that we've travelled. But the future's fantastic.
Cheers. Cheers to Emery.
Thank you. Thank you. Yeah.
Take care, mate.
Another 20 years with you guys, I don't know about that.